Okay, if you could turn your videos off, that would be great. Good evening and welcome to the Ayurvedic Association of Canada webinar on dementia. I would like to introduce Todd Caldecott. He is going to do our presentation this evening, and I'll just give a little rundown on Todd's bio. And then Todd, if you'd like to add anything, you can for sure. The presentation will be about 45 to 50 minutes long. If you could please turn your videos off, that would be appreciated. The presentation will be about 45 to 50 minutes long. And then we will have an opportunity to have a question and answer period at the end for Todd. And you can either ask directly or you can put it in the chat box, whatever you're more comfortable with. So Todd is the director of Dogwood Botanical School, and he's been an Ayurvedic practitioner and herbalist for 26 years to 30 years, Todd. Is that about right? You don't look old enough for that.
All that good, clean living.
That's right, all that good, clean Ayurvedic living. So Todd's also a registered medical herbalist, and he's written a couple of books, The Science of Ayurveda, The Science of Life, Ayurveda in Nepal, and Food is Medicine. So he's a well-written author on Ayurveda, and he also teaches at his school. So you can take different courses with Todd on Ayurveda and herbalism. I've taken a couple of your courses a long time ago, maybe 10 years ago, Todd. It was a great course. So thank you for that. So I'll introduce Todd to you, and he can add to what I haven't filled in for him and give you a little clue into what he's going to talk about today. Todd, you go ahead.
Okay, great. Thank you so much, Erica, for that introduction. So hi, everyone. My name is Todd Caldecott. And as Erica said, I'm a medical herbalist and a practitioner of Ayurveda. I've been in this field now for 30 years, practicing for 26 of those. I'm also the director of the Dogwood School of Botanical Medicine, where I offer both online and also in-class training. We have a new semester coming up that begins on April 10th. And just based on some feedback, I know a lot of people are kind of struggling financially. We thought at the end of the pandemic, things are going to start rolling again. Of course, now we're sort of looking at World War III and inflation, and there's a lot of hesitancy and difficulty people are experiencing. So we've actually offered all of our online programs at 50% off. So this is kind of remarkable. We'll kind of see how that works out for us financially, because of course we do have ongoing costs. But it's important to make sure that we get the information out there, especially now. I think there's so much reason to ensure that we are getting accurate information on health and wellness, just because the information environment is so convoluted and difficult these days. And there's so much polarization that I just want to make sure that we provide people with information and knowledge that helps support them. So check out the school, dogwoodbotanical.com. And yeah, I won't get into too much else about myself. There's certainly more you can read about me on the internet. If you have any questions, you can certainly contact me. Today, I'm going to present a lecture on dementia. Now, I originally developed this lecture as a presentation for practitioners. So this is like a practitioner level presentation. And I've been told that we've only got like 45 minutes to cover this content, and to do all of the content I have in slides justice, it would probably be more like 2 or 3 hours. So I'm going to burn through a few slides and kind of whip over some complicated topics, especially getting into the pathophysiology of dementia, and just kind of get to the real salient points and specifically review more of the treatment perspectives and come at it from a variety of different perspectives. So as you might be able to tell, I mean, I've had a long interest and fascination with Ayurveda, but I'm also trained as a Western medical herbalist, and I have some training in Chinese herbal medicine as well, and also a lot of training experience in clinical nutrition. I've also taught anatomy and physiology and pathology. So I kind of look at health from a variety of perspectives. Ayurveda is sort of the base modality that I use to help me understand and integrate all that different information. But you'll see that I employ methodologies of understanding and practice from a number of different perspectives. So hopefully that's okay with all of you. I mean, we're not conducting this this lecture today in 5th century India. We are 21st century people in North America, and so we have to deal with the reality in which we live. And so that includes discussing a number of different topics and looking at this issue of dementia from a number of different angles. So I'm going to share my presentation, and hopefully you can see that. And we'll just start it. There we go. So this lecture originally titled Phytotherapeutic Perspectives on Dementia. Phytotherapeutic simply just means like botanical or herbal medicine. Obviously, that is the primary modality of Ayurveda, and I will specifically cover and discuss Ayurvedic interventions for the treatment of dementia. Okay. We got some background noise there.
I'll turn them off, Todd.
Okay, thanks. So what is dementia? So dementia is just a generalized term that we use to describe a progressive impairment of memory, of cognition, of behavior that affects an individual's ability to function normally. And the most common cause of dementia is Alzheimer's disease. So for a lot of people, dementia and Alzheimer's disease is synonymous, but they're not. Dementia is the broad term that we use for any kind of cognitive impairment, of which there are many different types, and of which Alzheimer's is the predominant form. But there's also cerebrovascular dementia, there's Parkinson's disease, Lewy body dementia, frontotemporal dementia, Huntington's disease contributes to dementia. Traumatic brain injury can be a causative factor for the development of dementia. Viral infection, like HIV and also COVID. I won't spend a lot of time today talking about long COVID, but of course, we're definitely seeing people that have been afflicted with COVID and are experiencing some degree or some impairment of sensory function. And the pathophysiology of that is fairly apparent when I get into that. You'll sort of see why there's this link between COVID and increasing your risk of dementia. And then bacterial infections such as Lyme or syphilis, and then prion disease. So the Creutzfeldt-Jakob disease, or so-called mad cow disease, or Kuru, which was a disease that's really no longer found, but was found in isolated groups in Africa from similar causative factors, eating the neural tissues of infected hosts. Now, we use the term mixed dementia, and this refers to features of a few different pathologies. So, we describe all these different pathologies, but it doesn't mean that you just get one or the other. You can have a mixed manifestation. So you could have Alzheimer's disease with some Lewy body dementia and also vascular dementia. So you can get an admixture of different factors at play. And often it's not very clear exactly what form of dementia someone has. Even for something like Alzheimer's disease, you can only really get a definitive diagnosis upon post-mortem. And then you're looking at the brain tissue after the person has died, right? And so Alzheimer's disease really is kind of a post-mortem diagnosis. So when you get a diagnosis, or someone gets a diagnosis of Alzheimer's disease, it's a probable diagnosis. So Alzheimer's disease is the most predominant form of dementia, described in the early 1900s by Dr. Alzheimer. He found it in a 51-year-old patient that suffered from severe form of dementia. He later performed an autopsy and found the accumulation of what he called a peculiar substance in the cerebral cortex. This was later determined to be a 40 amino acid protein fragment called amyloid beta protein. So you might have heard of amyloid beta, Alzheimer's, and dementia, and that's the link. And then later he published his findings, and then soon after, Alzheimer's disease became a recognized pathology. It's important to talk about the clinical features of Alzheimer's disease. And of course, there's going to be overlap with other forms of dementia. So dementia is the primary feature, this cognitive impairment in memory. Often you'll see that there are disturbances in comprehension and language. Other symptoms such as confusion, poor memory recall, impaired or difficult speech, altered judgment, impaired abstract thinking. Often people with dementia and Alzheimer's will complain of just not feeling like they're themselves. They'll experience a loss of interest in favorite pastimes. So anhedonia, which is an important concept and also important to consider in looking at preventative factors in dementia. So people that for long periods of time don't experience much pleasure in life are increased risk of later developing dementia. A diminished creativity and ability to express affection or experience pleasure, as I mentioned, anhedonia. There are often language disturbances, so an inability to find the correct word or the use of filler words in conversation. The feature of circumlocution or talking around a subject, like, it's like when you're trying to remember something, someone's name or some word, and you're talking around it, like you can't remember it until finally you get it. Well, this would be a distinct clinical feature of someone with progressive dementia. There's often an inability to express one's thoughts in written form or comprehend the written word. And then difficulties in performing everyday tasks, such as dialing the telephone or unlocking the door. You might also notice some other features, such as a deterioration of personal hygiene, inappropriate dress, a loss of social graces, losing and misplacing items, repeated traffic accidents, irritability, stubbornness, suspiciousness and paranoia, a short attention span, and inability to perform simple instructions, and an obsessive detail to often trivial matters. It's important to make sure that proper differential diagnosis is undertaken before Alzheimer's disease is diagnosed. This could include multi-infarct disease, Parkinson's, depression, alcoholic dementia, hypothyroidism, adverse drug reactions, vitamin B12 deficiency, hydrocephalus, which is increased cerebrospinal fluid in the ventricles of the brain, and infections such as syphilis and HIV. So dementia as a category affects about 50 million people worldwide, and 60 to 70% of these people are diagnosed with Alzheimer's disease. The current prevalence of dementia is more than double the estimated number of cases in 1990, making dementia among the top 10 causes of death. It's most commonly found in people over the age of 65. However, it is increasing in frequency with each succeeding decade, so that nearly half the people above the age of 85 will end up suffering from some form of dementia. Although the risk of dementia increases with age, it can occur before the age of 65. This is described as early onset Alzheimer's disease. We'll talk a little bit about that. It's mostly related to genetic factors. The incidence of dementia appears to be increasing in low to middle income countries, whereas in developed nations, the rate of dementia appears to be slowing. So we've kind of hit peak dementia in the affluent Western world, and the prevalence and rate of dementia appears to be slowing down or decreasing. Women appear to have a higher risk of dying from Alzheimer's disease than men, particularly in the population older than 85 years old. This is explained due to the fact that women generally experience greater longevity. So there are actually 2 women for every man over the age of 85, and hence there's going to be increased risk that they will die of Alzheimer's disease. Also, Alzheimer's disease related brain changes tend to be more severe in men. And so women are less likely to express the features of clinical dementia at an earlier age. Partly this is explained by gender-based differences in the pathology, in which males demonstrate a greater decline in the posterior associated regions of the brain, and females more in the frontal and temporal limbic networks of the brain. But this worse prognosis for women might also relate to the fact that generally women have a higher cognitive reserve than men. It's sort of a simple way of saying that women just overall tend to be a little more psychologically, mentally resilient. We could say smarter than men, maybe that's kind of pushing it, but just in the sense that they don't experience the same rate of cognitive decline as men at an earlier age. And so that when women start expressing symptoms of Alzheimer's disease, the neurodegeneration is actually more progressed at that point, right? So that cognitive reserve just shows their inability, their ability to withstand expressing the clinical features of dementia for longer than men do. Men have a quicker onset, more severe presentation, and will tend to die sooner and often die of other issues. Whereas women are longer lived, have a higher cognitive reserve, and so seem to get by with dementia before they are finally diagnosed, at which point the dementia is demonstrated to be fairly severe. Let's discuss briefly the pathogenic factors of Alzheimer's disease. So the primary pathological feature of Alzheimer's is an atrophy of the cerebral cortex. This is due to the death of billions and billions of neurons. And upon autopsy, there are two primary distinguishing pathological features. These are the formation of plaques within the interstitial spaces between neurons and the development of what we call neurofibrillary tangles within neurons. Okay, so there's pathological features that exist in between the neurons and then within the neurons themselves. Also, so you see the representation there of amyloid plaques and the neurofibrillary tangles. Also, look at the development of the amyloid plaques and the neurofibrillary tangles and where they occur in the brain and how they tend to progress within the brain. This is really important, and I'll come back to this because this provides us with some clue about the pathological origin of Alzheimer's and other forms of dementia. It's linked to infectious diseases like COVID and things that we can do to prevent and treat it. All right, so this is one of those slides where I probably won't get into such great detail. So this slide is just discussing the development of amyloid beta in Alzheimer's. So these are basically tiny waxy deposits of this protein, amyloid beta protein. Also, there are varying levels of inorganic aluminum that appear to be part of these plaques. And this amyloid plaque begins to accumulate in the brain, typically well before you're seeing neuronal degeneration and before you see any symptoms of dementia. It's thought that maybe beta amyloid begins to accumulate as early as being a young adult. So it just goes to show that it's really important to take care of your brain and neurological function at an early age. It's not something that you really should be addressing only at the end of someone's life or only as they're exhibiting distinct clinical symptoms of dementia. That process of the neurological changes and pathology has been happening for some time, and it's happening to all of us. So we need to be aware of that. And there's been some debate about whether or not amyloid beta is in fact pathological, kind of like in the same idea or notion with cholesterol. For years, cholesterol has been fingered as a pathological agent in cardiovascular disease, but there's always been a perspective in increasing research to suggest that cholesterol is not actually pathological. It's a symptom of the body trying to restore homeostasis to those tissues, trying to repair damage. And because we don't deal with the underlying pathology, the cholesterol continues to accumulate. So likewise with the beta amyloid, that maybe it's accumulating to protect the brain. And so, drugs and other therapies that are used to target beta amyloid, like drugs for cholesterol, may end up being counterproductive. There's also tau protein, alpha-synuclein proteins in Alzheimer's disease and dementia that we need to take into consideration. So whereas the beta amyloid is occurring between neurons, tau protein is found within the neurons themselves that are damaged, and specifically is found within what are called these neurofibrillary tangles. These are comprised of the twisted fibers of tau protein. Now, normally tau protein maintains the cytoskeletal structure of neurons. So, it's basically like the inner scaffolding of the neuron to maintain its structure. There's some kind of external pathological process that causes those tau proteins to get all twisted and tangled up, impairing the function of the neurons. Essentially what happens, they become hyperphosphorylated. They pair with other threads of tau, and then they form these tangles, and it causes the microtubules within the neurons to degenerate, to disintegrate. And these microtubules are essential for communication within and between neurons. So it ends up destroying information processing and transport systems within neurons, and gradually resulting in their destruction. There's also alpha-synuclein. This is another protein that plays a role in regulating the release of neurotransmitters. And it's also been shown to aggregate as insoluble fibrils that are found specifically in Parkinson's disease and Lewy body dementia. So it's just another type of pathological tissue that is found in different forms of dementia, like amyloid beta, like the hyperphosphorylated tau proteins and the neurofibrillary tangles. We have alpha-synuclein, and specifically alpha-synuclein is found in high levels in Parkinson's and Lewy body dementia. So in the early stages of Alzheimer's, the neurofibrillary tangles and the plaques begin to develop in a region of the brain called the medial temporal gyrus. This includes the hippocampus and major portions of the olfactory system. So basically in this region of the brain, okay, so this is the brain stem right here in the olfactory region of the brain. This is the locus, and you can see it here. The amyloid plaques accumulate here, and also the neurofibrillary tangles in the olfactory region of the cerebral cortex. And wherever you see these pathological tissues accumulate, there's a loss of neurons, a loss of nerve synapses. There's a diminishment of acetylcholine. Acetylcholine is in large part how different neurons communicate with each other within the brain. So we're losing synapses that release and receive acetylcholine. And then also we gradually see a diminishment of other important neurotransmitters in the brain, such as norepinephrine and serotonin, that are essential to maintain the function of those higher cortical centers. Okay. Now, there's an important theory behind Alzheimer's disease and dementia, and it refers to the role of cerebral spinal fluid. So if you're not familiar with it, that your brain is bathed in a fluid, not just your brain, but also your spinal cord is bathed in a fluid called cerebral spinal fluid. And it circulates through the ventricles of the brain and down the spinal cord and back up, circulates around. And its main function is to nourish and protect neurons and to serve as a medium to receive the metabolic wastes of the brain. So just like our liver and other organs are producing waste and toxins, so does our brain. In fact, a fair amount, considering the high metabolic capacity of the brain. And it's the cerebral spinal fluid that receives these metabolic wastes, and they need to be discharged from the brain. They can't stay in the brain. If they do, just like you would imagine, what would happen in a backlog of waste and toxins is that these start to induce some type of pathological change, some type of toxicity. So the way the cerebral spinal fluid flows in the brain essentially is it flows down the spinal cord and up, back up the other side, and then back up to the brain and then around the cerebral cortex. But it's a significant portion of the cerebral spinal fluid is shunted to the olfactory region of the brain, to the cribriform plate. And this is where many of the metabolites are carried away by the lymphatic system of the nose. So where's the cribriform plate? Well, if you could take your tongue and put it in the back of your throat and stick it up your nasopharynx, it is at the very top of the nasopharynx. This is kind of relevant or important to the practice of certain forms of yoga. You might be familiar with the technique that's used by some yogis. I don't recommend it, where they gradually cut the frenulum of the tongue that holds the tongue to the base of the mouth, and then take the tongue and insert it in the nasopharynx and up and block the flow of amrit, which is stated to be like a nectar that's generated in the brain that drips out of the brain down the nasopharynx and then gets destroyed by the heat of Agni in the digestive tract. So this notion is that you stick your tongue up there and block that flow. It's not so relevant to what I'm talking about today, but it's still interesting because it does illustrate the importance of this particular region of the brain. And what we're seeing right here is if we could take a camera and look inside the nasopharynx and look directly up. This is what you would see at the roof of the nasopharynx. Okay, and this is in a 26-year-old, and this is in an 80-year-old. Okay, and so there's a big difference between them. So essentially, what the cribriform plate is a sieve-like bony structure that contains numerous vessels that is a main shunt for the release of cerebrospinal fluid. So it's the main way that our body discharges the metabolically laden cerebrospinal fluid from our brain. So we discharge it. So you might not be aware that you basically leak cerebrospinal fluid from your nasopharynx into the lymphatics of your nose, and it's taken away. And what happens is, as we age, and especially with chronic pathologies in the nasopharynx, that the sieve-like structure of the cribriform plate becomes progressively more and more ossified or calcified and impairs flow. There's a reason why it's like a sieve. So there are all these vessels and lymphatics that allow for the removal of this metabolic waste. Well, if it gets progressively more and more ossified, more calcified, then it impairs that flow. And that means that metabolic wastes don't leave the brain. They stay and accumulate in that olfactory region of the brain, which, as I've already pointed out, is the major locus of where the different forms of dementia begin. So this is a really important point because it's this backlog of these metabolic wastes in cerebrospinal fluid that causes local inflammation and damage. And then in turn, the brain produces amyloid beta in the interstitial spaces to protect the neurons. But because that situation is never resolved, this continual aggregation of proteins in the olfactory region of the brain results in the progressive formation of plaques, the accumulation of tau protein, and the development of these neurofibrillary tangles. And then you start to see the spread of these pathological tissue changes spreading from the olfactory region into progressively into other parts of the brain. So that's important. I'll kind of touch back on why that's important in looking at some of the treatment options. So let's review the etiology of dementia and Alzheimer's disease. So because there's so many different forms of dementia, and even with Alzheimer's disease itself, that there's a multitude of factors that contribute to it. I know in Western medicine, we really like to find the cause of a particular disease, but the reality is that in life, it's not very often there's just one cause of anything. There's usually multiple causes. Like think of anything that's happened in your life, you know, the most important events in your life, and just think of all the factors that needed to be in place for those events to happen. It wasn't just one thing. It was a multitude of things. So it's the same case with Alzheimer's disease and dementia. So when we look at it, apart from the fact that it definitely is linked to modern lifestyle, it probably results from the combined effect of genetic, vascular, infectious, immunological, environmental, and dietary factors. So I won't spend too much time talking about the genetics, but certainly for the early onset form of dementia, which is fairly rare and severe, it's found in less than 10% of all people, there is a genetic link. It occurs severely in people between the ages of 30 to 60, and it's linked to 3 single gene mutations in amyloid precursor protein, presenilin 1 and presenilin 2. There's also a genetic risk factor associated with the apolipoprotein E gene. But this is distinct from most forms of dementia that you're going to come across, or you're going to see, excuse me, or that you're likely to experience. It's, as I said, it's pretty rare and has such a rapid and severe onset. There's not a lot that we can do about it at that point. Now, it's important to talk about the risk of dementia in vascular disease. This is a really important link. Just imagine if you're just not getting enough blood flow to the brain, how that's going to impair the nourishment of the brain, its neurological function, getting sufficient oxygen and nutrients, as well as the discharge of wastes. So if there's like some type of occlusive disorder that impairs blood flow to the brain, then this will increase your risk of dementia. We call that specifically vascular dementia. So a thickening of the vascular walls, it occludes blood flow to the brain. And this can also be facilitated by beta amyloid can accumulate in those vessels as well and contribute to that. So we have to look at these cardiovascular disease risk factors. So obesity, diabetes, smoking, hypertension, dyslipidemia, a history of stroke, they all significantly increase the risk of developing dementia, and specifically midlife obesity. So around my age, I'm 53. So, if for the past decade and continuing on for the next decade, if I was overweight and was smoking, was struggling with diabetes, this would dramatically increase my risk of cognitive decline as I get older. Although what's interesting is that people who maintain a mild obesity in their senior years, this appears to be protective. And we can kind of understand this from the perspective of Ayurveda. We would say that those people constitutionally probably have like a fair amount of kapha. And having kapha is just like having a little extra money in the bank. We can definitely correlate Alzheimer's and dementia with Vata disorders. And so having that proclivity towards a kapha in the latter stages of life seems to have a protective effect. So no surprise there from an Ayurvedic perspective. So impaired blood flow is also going to impair the movement of nutrients like blood glucose. So this is something we'll also see that becomes impaired in Alzheimer's, is that there's a diminishment in glucose metabolism in people with Alzheimer's disease. This could be caused because of a reactive hypoglycemia due to the overconsumption of carbohydrates. It could be because of using too much insulin, as some diabetics do. I mean, this is a common problem we'll see in diabetics. This is that they get diagnosed with diabetes, they're put on an insulin dosing regimen, and then they have to accommodate their diet to that regimen instead of changing their diet and then accommodating an insulin regimen to what they're actually eating. So in other words, people are injecting too much insulin, and it's impairing the movement, the distribution of glucose to the brain. But also issues like calorie restriction, also caffeine, alcohol, and tobacco are also suspected as possible causes of impaired glucose metabolism in the brain. There's an important link with gut health, and this should be no surprise of us who practice Ayurveda, that it's been shown that alterations to the gut microbiome increases gut permeability. This leads to systemic inflammation, which in turn impairs the blood-brain barrier. So if you're not familiar with this concept, just like you have a barrier in your gut that is a selectively permeable membrane that allows nutrients that have been broken down to flow into circulation and then distributed to the rest of the body, to the liver and to the rest of the body, your brain likewise has this barrier of selective permeability. And the way things work from this holistic perspective in Ayurveda is that the function of selective permeability is regulated and determined by the gut. So other tissues that also rely on this function of selective permeability, if the gut's permeability is impaired, then likewise, those other barrier functions also become impaired. We can understand this in Ayurveda. Like if your digestion is off, then you can understand how it might affect also your metabolism. Right? So the function of digesting and liberating energy within the gut is also replicated on a cellular level throughout the body. And it's the function of the gut that regulates that function and maintains it. So likewise, that function of selective permeability of the brain is maintained by the gut. And it appears that the integrity of the blood-brain barrier is a key element in the pathology of dementia. And it's thought that after the age of 70, nearly 60% of adults have leaky blood-brain barriers. And we would assume from that also that they have gut permeability at the same time. It's also been shown that the bacterial amyloids that are generated in the gut can also prime the immune system and enhance the inflammatory response to amyloid beta and alpha-synuclein in the brain and promote neural injury, inflammation, injury, and death, right? So there's basically a mechanism through, for example, like the vagus nerve, where it is inducing the commensurate changes in the brain as we're seeing in the gut. So I was harping on this issue of looking at the function of the cribriform plate because there's this really important link between dementia and oronasopharyngeal diseases and also dental infection. So definitely there's a correlation between oronasopharyngeal infections and dental infection. And one of the things that you can see with the neural degeneration of dementia, it's accompanied by an increase in the concentrations of pro-inflammatory cytokines. These are little molecules that are released by immune cells to stimulate inflammation. You've heard of the cytokine storm for problems like COVID. These are immune cells that just release these little modulators that then upregulate or enhance the immune response. They're also just released with any type of inflammation. And it's the same cytokines that we're seeing in the brain that are also elevated in the mucosa of patients that have chronic rhinosinusitis, right? So just, this is this area, the top of the nasopharynx where the cribriform plate is, if you've got chronic inflammation there, then it's also going to be inducing inflammation in adjacent regions of the brain, simply because of its location. It's just right next door. So apart from the fact that in chronic rhinosinusitis and other oronasopharyngeal infections, is you've got all this bacteria and fungus that are living there, that are inducing inflammatory responses and may even be leaking into the brain because of that impaired blood-brain barrier. They're taking advantage of it, and they're also weakening and damaging it. This is one of the things that possibly COVID is doing, is damaging the function of the blood-brain barrier. So not just the nasopharyngeal region, but also the mouth generally, dental infection. It's been shown that people that have periodontal disease have a significantly higher risk of dementia and than people that don't. And they've even found the bacteria that cause dental decay, it's been isolated in the brains of people that have Alzheimer's disease. And there's been some preliminary research on this, but it's been known for years that people that have like chronic rhinosinusitis or have chronic nasal polyps, when those are removed or surgically removed, I'm not saying that that's the way to do it. Like, I have treatments for nasal polyps that don't involve surgery, that are more sustainable, that get to the underlying cause of the issue. But let's say someone has that issue, they get them removed. There's usually a commensurate improvement in cognitive function, simply because now they can breathe through their nose again. So this area is so important to maintain proper brain health. It can't be underestimated. There's also a link between Alzheimer's and spirochetal diseases. So here we're talking about diseases like Lyme and syphilis. It's been known for centuries that syphilis is associated with the later development of dementia. And the features of dementia in terms of the neuropathophysiology are basically identical to what we see in syphilis, this accumulation of amyloid beta. So it's thought that maybe amyloid beta, apart from being protective, is also accumulating because of bacterial infiltration into the brain. And these little motile bacteria, that's what spirochetes are, they're basically bacteria with a little tail, like a little sperm cell or something. They can weasel through the body. This is why they're so difficult to get rid of, and weasel in through the blood-brain barrier and enter into the brain. They multiply, they produce a biofilm. This activates the immune system and then results in localized inflammation that then causes damage to neurons. So this is true for syphilis, and it's also true for Lyme disease. This is why we often see an issue of cognitive impairment in Lyme disease. And so likewise, we're also seeing this with viral infection. So it's been known for also quite a long time that viruses can contribute to Alzheimer's. This includes herpes simplex virus, both 1 and 2, and also the HIV, the human immunodeficiency virus. So these viral pathogens can pass once again through the blood-brain barrier. They can induce neural inflammation, and then it leads to these characteristic tissue changes, that accumulation of amyloid beta and the hyperphosphorylation of the tau protein. And most recently, we've seen that the SARS-CoV-2 virus, so the COVID virus, has been linked to an increased risk of dementia. The spike protein has been shown to damage the integrity of the blood-brain barrier and alter its function. And this appears to allow the virus to enter into the brain through these olfactory pathways. Remember, where does COVID primarily replicate? It's in the nasopharynx, right? Right next to your brain. And, we don't have any clear evidence for this yet, but obviously some people with COVID are experiencing anosmia, and so a loss of taste because of damage to the olfactory mucosa and neurons. And it could be that those people are possibly at greater risk of developing dementia later on. If that's you, I don't want you to worry, but I want you to just remember this and take this in hand so that you can take appropriate measures, right? So, and this is something that could have happened even without you having a severe COVID infection, which is why it was so important to do everything we could to inhibit COVID infection, including vaccines and vitamin D and social distancing and all those different things. They were all important because, you don't want to end up with dementia because of inflammation to the nasopharyngeal mucosa, which then ended up causing damage to the olfactory region and blood-brain barrier of the brain. There's also a link between Alzheimer's disease and environmental factors. We know that just exposure to traffic noise. I live in the country now, so I'm kind of free of that. So, I go down to Vancouver to visit, and I'm blown away with how noisy it is. Like my nervous system is just not used to it. And, you do get used to it, but let's face it, we have a very primeval body that evolved, for millions of years without constant traffic noise. And, we may become adapted to it, but do we really completely adapt to it? We just normalize it. Just like we normalize all kinds of things in our life, like war and violence, it's just normal, but, it obviously causes damage. Pollution has also been shown linked to causing a higher risk of dementia. So people that live in really polluted environments, I think we're going to see just in this last 50 years, especially the last 20, 30 years, we see in places like China and India, just, out of control urban pollution, that we're probably going to see a whole cohort of people that are increased risk of dementia, as well as cerebrovascular disease and cardiovascular disease generally, and other diseases like cancer. There's a link between organic aluminum and Alzheimer's disease. Aluminum is known to interfere with enzymes that are needed to metabolize glucose for energy production. It causes destruction to the blood-brain barrier. We know that fluorine in water enhances aluminum absorption. So it should give us pause to consider whether or not water fluoridation programs are actually all that good. It's different from using fluoride-containing toothpaste that you spit out, but consuming fluoride is a whole other potential issue that we need to address. But definitely you want to make sure that you avoid aluminum as much as you can, aluminum cookware, especially the aluminum cans. You just put water in an aluminum vessel or even any type of metallic vessel, and you leave it in there for 10 minutes and you can taste it, right? Those are metal ions that are leaching into the water. There are nutritional factors in Alzheimer's and dementia that we need to consider. And this is really important because these are modifiable risk factors. Like it's hard to deal with pollution. You may be unfortunate and get Lyme disease. We can treat those things and prevent them as much as possible. But one thing you can do for sure is you can take care of your diet. You can make sure that you're eating well. There's a bunch of research on this. There was a hybrid of the Mediterranean DASH diet called the MIND diet that was found to promote better memory and thinking skills in people as they became older compared to controls. But it sort of completely opposite to that. There's been trials on a modified ketogenic diet, which is basically like a low carb diet. This was also found to improve daily function and quality of life in people that are clinically diagnosed with Alzheimer's disease. And the key thing, I think, between all these different diets is that they're an avoidance of what we call the standard American diet, the SAD diet, the poor SAD diet that unfortunately most of us here in the Western world are exposed to and we think of as a normal diet. It is a diet that will give you chronic debilitating disease, increase your risk of dementia and Alzheimer's disease. And key component is sugar. Sugar is a game changer. It alters the microbiome, especially the oronasopharyngeal cavity, and induces and promotes inflammation. It alters glucose function in the brain. So avoiding sugar is going to be very, very helpful. Also, refined, peroxidized fats and oils, we call them trans fats, but any type of refined oil or oil that's been used for high heat cooking should be avoided. And then just processed foods generally. So any diet that you follow, whatever it is, it should avoid those constituents of the standard American diet. So refined, processed, prepackaged foods, all of your food should be as fresh as possible. Some specific factors: gluten. Alzheimer's and dementia is associated with celiac disease and also non-celiac gluten sensitivity. Gluten has been shown to impair cognitive function, and it does this because it also induces nutrient deficiencies. It causes damage to the gut wall. It induces systemic inflammation. It plays a role in the impairment of serotonin synthesis by inhibiting the absorption of tryptophan. There's a link with meat and alcohol. So the risk of dementia is increased in those that regularly consume processed meat. There's a big difference between processed meat and fresh meat. So if you like to eat things like bacon and other types of preserved meat, I would just have it like very occasionally and not every day if you eat meat. Otherwise, just fresh meat doesn't appear to be linked and might be suitable if, say, you're following something like a ketogenic diet. Alcohol consumption is definitely associated with brain damage. I mean, the immediate metabolite of alcohol, acetaldehyde, is toxic to every single cell in the body. There's no cell that has any type of resistance to acetaldehyde, and that's what we all produce. And so if you drink alcohol and you're drinking a half a glass of wine and sipping it, and you're just enjoying the taste of it and you don't notice any effects of it, then it's probably not having any effects. But just as soon as you notice some of the effects of alcohol, you're getting a little tipsy, maybe moving towards that kind of, drunk, that's basically showing that you now are consuming alcohol in excess of your body's ability to metabolize it. And the result of that is that it will cause tissue damage and damage to your brain. All the research that's coming out shows that there's really no safe level of alcohol consumption. But I would use that rule of thumb, which is that you can drink it. If you don't feel the effects of it, then you're probably okay. And that probably for most people is going to be something like, like one or less beer, one or less glass of wine, and not more than that. Other nutritional factors to consider are essential and accessory nutrients. So adults that are moderately deficient in vitamin D3 have a 53% increased risk of developing dementia and 125% increased risk in the severely deficient. You know how important it was in preventing COVID severity. Here also very important as well. Not just linked to vitamin D, but vitamin D also is associated with outdoor physical activity, which is so important. We'll talk about that in a second. Polyphenols, so all the colors that are in your diet are so important to stave off inflammation and prevent brain damage. And so I recommend eating a rainbow of foods in your diet. Just don't eat the same color. I know there's some bad diets out there. Who's that? Some guy in medical medium. I don't know anything about it, but I've had some people that have followed his advice and been on something like the banana diet or something. It's just like, oh my God, it makes no sense. Don't follow that guy. It's just a bunch of claptrap as far as I can tell. Eat a rainbow of nutrients in your diet. All these polyphenols and flavonoids are so good for reducing inflammation. They improve verbal fluency. They enhance short-term memory and also long-term memory. Chili. Now, some people really love chili. Of course, if you follow Ayurvedic practices, then you know that chili is not an indigenous food of India or Indian cuisine, but doesn't stop the fact that most people in India are addicted to chili. A little bit of chili is fine, but it's been shown that consuming upwards of 50 grams or more of chili per day, and some people do get that level, is associated with enhanced cognitive decline. By every measure, chili is a very powerful stimulant. And if you consume too much, then it's going to have net inflammatory effects and enhance cognitive decline. Coffee consumption. There's always a debate about coffee. Should I drink coffee? Should I not drink coffee? And the media just loves to sort of spin the confusion around coffee. You need to listen to your own body. If it makes you jittery and upset and irritable, if it gives you gut rot and diarrhea, then you're consuming too much coffee. High levels of coffee consumption are also associated with chronic muscle pain and back pain. And so, the idea of drinking 6 cups a day is no surprise to me that there's a 53% increase in the risk of dementia and brain atrophy. That's too much. It doesn't mean that coffee entirely is bad. I think having 1 to 2 cups of coffee for most people is probably fine if it's suitable to your temperament. I always like to put a bit of cardamom in my coffee, and that helps to ameliorate some of the negative effects that it might have in terms of the jittery feeling and also in terms of how it impacts the gut. A whole host of food additives. I've been talking about this for decades. So MSG and artificial sweeteners, there's just been some recent research showing that there's a documented link now between artificial sweeteners and the later development of cancer. You want to avoid it. Okay, so avoid those types of additives, MSG and artificial sweeteners. We know that the higher cumulative intake of artificially sweetened soft drinks is associated with the increased risk of all-cause dementia and Alzheimer's disease. In particular, aspartame is very toxic to the brain, in part because 10% of it is actually is basically methyl alcohol. And methyl alcohol, it's so damaging to the brain, to neurons, to the sensory organs like the eyes. So you want to avoid that. And then aspartic acid is pro-excitatory in the brain, so it induces brain inflammation, and phenylalanine starts to mess with some of the genetic functions within the brain. Okay, so let's review briefly holistic treatments of dementia and Alzheimer's. So we want to prevent dementia because when someone starts expressing dementia or exhibiting symptoms of dementia, it's already progressed to a significant degree. So if you don't have any symptoms of dementia or your loved ones, start working on preventing dementia now. It's not to say that you can't stall cognitive decline, or someone presents with dementia that there aren't things that you can do to inhibit it and maybe even reverse it a little bit. But let's face it, when those neurons are being damaged, it's really hard to get back neurological function. For years, it was thought that neurons can't be restored or repaired, that once you lose a neuron, it's gone forever. There's now research to suggest that that's not actually true. You can actually claw back some of that damage, but it's going to take a holistic approach to deal with it. So general anti-aging measures are taken to ensure the proper circulation to the brain, to prevent oxidative damage, to promote physical rejuvenation. In Ayurveda, we call this rasayana. In Chinese medicine, fuzheng. In the Western herbal medicine, we call it trophorestoration. One thing is important to address the issue of chronic infection and dysbiosis. So chronic gut dysbiosis, periodontal disease. I'm so glad to see that there's some movement afoot here in Canada anyway to start taking care of people's teeth. It's not a part of the healthcare system, but it's hopefully going to be. Your teeth and rotting teeth and gingivitis and all the bacteria that accumulate, it's right next to your brain. So if you're harboring a chronic infection, it's very likely it's going to seep into your brain through the oronasopharyngeal link. So, dealing with chronic rhinosinusitis. I mean, how many people just suffer from chronic sinusitis? And it's just sinusitis. We don't even think about it. It's like, oh, well, it's whatever. I just blow my nose. I got some congestion. Do you ever stop to think that that actually might increase your risk of dementia? And then also properly addressing diseases such as Lyme. I have some very good protocols for Lyme. So if any of you are suffering with Lyme or struggling with it and are not getting much success, I have some very good Ayurvedic approaches to deal with that. There is a strong association between a lack of mental and physical stimulation with the later development of dementia. So one thing that you can do to prevent cognitive decline is to use your brain, right? That whole notion of use it or lose it. And it's a really sad situation, especially in Western society, that when you reach a certain age of retirement, that you get shunted to a seniors care center where they park you in front of a TV in the dark and feed you a suboptimal diet. Why do these people develop dementia that much more rapidly? It should be fairly obvious. They don't have enough stimulation. They're not getting any sunlight for vitamin D synthesis, and everything in their diet is facilitating chronic inflammation. But beyond that, learning new skills, new hobbies, socialization, and preventing anhedonia. So just sort of, in order to activate and enliven the brain, you need to take pleasure in things, take pleasure in life. There's a lot of people that because of chronic depression or because they have this focus of working all the time, sort of type A personalities, they don't stop to take pleasure in life. You need to do that. There's such a strong correlation between anhedonia, which is just not taking pleasure in life, and the later development of dementia. So what all this does is it enhances what's called a higher cognitive reserve. So it just think about it, just gives more energy in the brain bank so that when you start to decline, as we all will, and from that experience some degree of dementia, as it declines, you have a significant reserve there to allow for some of that decline. But if you never do any of those things to enhance the cognitive reserve, that when dementia kicks in, that there's not much there to prevent the worst of the physical and mental, emotional symptoms arising. So also patients with mild dementia, physical exercise has been shown to reduce symptoms and improve body strength and aerobic endurance. And as I mentioned, some of this probably relates to increased vitamin D synthesis, so getting outside. So that's the correlation. It's getting outside, being physically active under the influence of the sun is so important. I mean, isn't this one of the major things that have happened in our society over the last 100 years is that we're not outside like we used to be. 150, 200 years ago, you got up in the morning and you were outside all day. You're outside doing stuff, fixing fences and, milking cows, gardening, walking to the general store, riding a horse, being outside. And, now we spend so little time outside. And when we do, we slap on sunscreen. It prevents vitamin D synthesis. There's no surprise that we're at higher risk of cognitive decline. So getting outside, fresh air, sunlight has all these important modulatory effects on preventing dementia. Also, psychedelic therapies have been shown to enhance neurogenesis. So microdosing psilocybin extracts, which I've quite a bit of clinical experience with, as well as macrodose of different types of psychedelic therapies, has been shown to enhance neurogenesis and to promote neuroplasticity, basically just making the brain juicier and more flexible, more open to new experiences. And that's exactly the kind of ethos that we need when it comes to preventing dementia. Let's talk about Ayurveda and dementia briefly here. So,
Todd, you only have a couple of minutes left. It's 5 o'clock.
Okay.
Okay.
So what would you like me to do? Just continue or just stop?
Continue for a couple of minutes if you want to talk about Ayurveda for a few minutes.
Sure.
And then we need a few minutes for questions. Thank you.
Okay. So dementia Alzheimer's are both considered to be vata disorders. So in Ayurveda, the general measures that we use to treat and prevent Alzheimer's is to reduce vata. So herbal medication, dietary and lifestyle practices, topical applications. Note that the primary seat of vata in Ayurveda is the colon, hence the link between the colon and the brain in Ayurveda. So something that has been validated just recently by modern medicine is a concept that's been practiced and understood in Ayurveda for thousands of years. So this could include the usage of medicated enema or basti, as well as massage, abhyanga, and nasal medications, nasya. And also just making sure that we're paying attention to the microbiome and providing some proper support. Some herbs that we can talk about in dementia and Alzheimer's: getting proper blood flow to the brain, cerebrovascular stimulants. Listed a whole bunch here: rosemary, bilberry, cayenne, ginger, prickly ash, hawthorn, danshen, ginkgo, dangui, guggulu, rhodiola. You're going to select those herbs on the basis of what's appropriate for that individual based on the case history, but they all help to promote blood flow to the brain. Nervine tropho-restoratives, we would call these medya rasayana in Ayurveda, herbs to exert a neuroprotective or regenerative effect within the brain. Mandukaparni, which is gatukola, or brahmi, which is bacopa, calamus, saffron, ashwagandha, milky oat, reishi, bala, amla, and then some Chinese herbs like xiangshen, American ginseng, wu weizi, heishou wu, lion's mane, cordyceps, maitake, and shilajit or shilaji. Remember that this whole dynamic of inflammation in the brain is caused because of an impairment of this movement of metabolic wastes out of the brain. So ensuring proper detoxification, removing the toxic load from the body, provides room for the brain also to shed its toxins. So bitter alternatives and cholagogues to promote detoxification, to reduce inflammation, to promote bowel motility, and also exert antimicrobial and antibacterial effects. Guduchi, chaihu, turmeric, gentian, dandelion, barberry, and also triphala. And then there's a whole assortment of orthomolecular approaches in dementia. These are nutrients. I've got a bunch of them listed here. The B complex, including methylfolate, methylcobalamin, and choline, vitamin C, D3, the essential fatty acids, chelated multiminerals, CoQ10, alpha-lipoic acid, grapeseed extract, resveratrol, the citrus bioflavonoids, phosphatidylserine, in particular, is something that's useful to help synthesize acetylcholine in the brain. L-carnitine also is essential for the synthesis of acetylcholine, and also then probiotics. And then lastly, dietary measures. Avoid foods that promote congestion, particularly nasal congestion. If the food that you eat promotes nasal congestion, it's not useful and will long-term increase your risk of cognitive decline. Also, foods that promote periodontitis, so flour products, and even if it's sticky or gluey, that gets stuck in your teeth, it's not a good idea. It's going to facilitate periodontal disease. Emphasize antioxidant-rich foods that support detoxification. Emphasize foods that are rich in the building blocks of acetylcholine, like free-range eggs and other sources of lecithin. Increase your consumption of live culture foods. Eliminate those trans fatty acids, hydrogenated fats, etc. Avoid sugar, artificial sweeteners, and food additives, and alcohol. And avoid aluminum-containing foods and foods packaged in aluminum. Also, some topical therapies. I'll just briefly throw these in here that we use in Ayurveda specifically. Bayasnehana topical abhyanga therapy with oils such as balashwagandha taila, mahanarayana taila, etc. Nasya chikitsa, so applying medications to the nose like anu taila, shadbindu taila, narayana taila, and then proper care of the mouth. Danta davana, jionirlekana, kavalagraha, gandusha, they're all helpful for promoting good oral health. And then specifically matravasti. Anyone can practice matravasti. Is taking a medicated or plain oil, about 50 ml or so, with a pinch of saindava or pink salt, and then administering that intrarectally before you go to bed. It's a retention enema. The oil gets absorbed. It reduces vata and helps to prevent cognitive decline. Okay, so that's it for my presentation as I just burned through the very last section. So I'm wondering if there are any questions that any of you have.
If you'd like to, you can write your questions in the message box, or you can just unmute yourself for a moment. Once you've unmuted yourself and asked your question, if you could just mute yourself again, that would be great.
Don't be shy, ask away. Oh, was there a question? I gotta put my glasses back on. There's a question.
So have you had much luck treating anyone for dementia once they have it?
Yeah.
I'm just curious.
Yeah, I have. I actually just have a patient I just saw yesterday, and she's on the memantine, which is a new dementia drug. It's not that new, but it's come out in the last few years. And we actually withdrew that drug, and slowly, and she's noted like a significant cognitive enhancement. So
this is a pharma drug.
Yeah, don't be afraid to look at some of the drug therapies.
Okay.
Drug therapies for Alzheimer's and dementia are pretty much ineffective. They don't do much. Mm-hmm. And there's good evidence that they're entirely counterproductive. So yeah, I have had good luck, but it often depends, of course, on how progressed the condition is.
Right.
So you're looking for those subtle signs and symptoms of nascent cognitive decline, and then getting aggressive about treatment. Then you can stop and or reverse that. For someone that has the severe genetic form of Alzheimer's, I've never had any success with something like that.
Right. Yeah, you're fighting too much in that case.
Yeah.
Like how about like panchakarma on the idea that there is like metabolic waste that maybe you could get rid of?
Sure, absolutely. Panchakarma could be a valid method. I don't practice panchakarma. It's not part of my scope of practice.
Right.
I do more of the shamana chikitsa.
Okay.
And in internal medicine.
Can I just interrupt for 1 second, Todd? There's lots of science. I'm getting my degree in a doctoral degree, and there's a lot of research now done on dementia, all kinds of, decline of the brain, and panchakarma from India. It's not as prevalent here in understanding that, but it's been proven to be a very efficient way to deal with any atrophy of the brain.
Just to add to that, okay. I've certainly been practicing for 26 years. I had seen many patients over the years that have received panchakarma and haven't received any benefits, because it's not necessarily commensurate with all the changes that need to happen, because these are like fundamental aspects of your life and how you relate to your lifestyle, your diet, and just going for 4 weeks or 6 weeks to India and getting some treatment without the follow-up and support, without making those changes, without taking medications on a chronic basis. I've seen it where it's not.
But there's post panchakarma that goes on for months for people.
I'm super familiar with
who the practitioner is. That's not a true statement, Todd.
Okay, so I'm just going in my experience.
Yeah, I'm sure it's not a panacea. Just as part of like the whole process. I mean, it's a complicated disease, so it cannot be just get PK and you're done. I'm sure that's not
right.
No.
Yeah, I'm sure it's one thing in the many things you have to do.
And also, you have to understand that everyone's a complete individual in Ayurveda.
Right.
So every therapy will be different. All the things that Todd does and all the things that panchakarma does.
Right.
Sorry for interrupting.
Good evening.
I've just seen some of the research from long-term pre-panchakarma, post-panchakarma work with a really certified, doctor, Avija.
I've seen the research too, and it's not enough to say that just doing one thing or one practice is necessarily gonna make the change.
No,
so
I totally agree.
Make sure it's part of the integrated approach, and also there's a lot of people practicing panchakarma incorrectly.
Yes, that's so true.
You go to India for 2 or 3 weeks and get panchakarma that's just not sufficient. The Purva karma, the Paschata karmas are not correct. So it's just that often people will resort to saying, oh, panchakarma for everything. And I can tell you that I see in my practice, people get panchakarma for any number of things and they don't get better necessarily. So it's important to make sure that, there's a reason why it's not the only treatment, in this library of texts that I have on my shelf, panchakarma is included in them, but it's not the only method or form of treatment. So it's not necessarily appropriate or suitable to every person for every condition. Dementia is about is looking at all the multifactorial components. Say it's treating something, if it's a spirochetal disease, something like Lyme disease, that takes a long-term treatment, and just getting 4 weeks of panchakarma is not going to treat that. It's not going to follow that.
No, I agree completely. I'm just
any other questions?
I don't have a question, but this is Dr.
Sorry?
Can you hear me?
Yeah.
I say I don't have a question. I have a comment. This
Sure.
is Dr. Stanley, and I'm a speech language pathologist, and my research is in dementia, focusing on face recognition.
Right.
But I have not really looked at the nutritional aspects of dementia, and I'm curious to learn more about that. And also this Petracontra, am I saying that correctly? Can you say that for me? Petracontra, the treatment that you guys are talking about.
Panchakarma.
Mm-hmm. Okay, I've never heard of that, so I'll be researching that.
Please
yeah,
do.
I mean, it's not, as a North American, it's not of probably much relevance, because there's really no place in North America to get authentic panchakarma treatment. I mean, you've got to pretty much go to India, and then even with India, you have to be fairly selective about where you go. But certainly, as a practitioner in North America, there's a whole host of things that you can start researching. And I reviewed some of those things when it comes to diet. As I mentioned, the standard American diet, the diet that most people eat in North America, will increase your risk of dementia. So as I said, make sure that your diet includes like a rainbow of foods, all the different colors in your diet.
I have a question about the treatment of Ayurvedic, like which stage of dementia that you can apply for Ayurvedic treatment?
Sorry, your question is what kind of?
Like which stage of dementia that we can apply Ayurvedic treatment?
Which diet?
No, which stage?
Like which stage?
Oh, in which stage? It's stage. Well, I mean, you could apply it at any stage. It's just what kind of clinical results can you expect? So if it's an advanced progressed condition, there's not a lot that we can do to kind of shift that. It also depends on the age of the patient as well. So if someone comes to me and they're in their late 60s, early 70s with certain nascent symptoms of dementia, then we can start implementing these changes and treatments, and we can stabilize the condition and even improve it. If someone comes to me like in their, say in their late 80s or early 90s and has dementia, their bodies, because of their age, it's undergoing some level or degree of degeneration. So mostly we're just trying to ameliorate and limit the amount of cognitive decline that we're seeing. But, because the body is degenerating, we're not going to get like an amazing turnaround. So it depends on the case history, depends on the age of the patient, depends on other comorbidities, whether that patient presented, for example, with issues of diabetes or obesity, whether they have like concurrent infection. As I said, if they're struggling with an issue with Lyme disease, periodontal disease. So it's a multifactorial thing. You have to look at each patient individually and then develop a protocol that addresses those issues as best as possible. But it's important to you're not just treating dementia, you're treating the whole body. You're treating the health of the gut, you're treating the blood-brain barrier, you're treating issues of chronic infection. So, you have to include all those different components.
We have time for one more question. It's 5:15.
Any other questions?
There was a question this is Dr. Stanley again, I'm sorry. There was a question in the chat. I would love to hear your expertise on the answer. It reads, the COVID mRNA vaccines teach our cells to create the spike protein in the body. Can you possibly contribute to, could this contribute to AD?
Well, people that get the vaccine, one of the things that you can see with COVID is that some people get COVID and they get the anosmia, right? They get the loss of taste and smell. And that occurs because of damage to the olfactory regions. And that's typically not what we're seeing in people that get vaccinated, right? So the risk or rate of that happening in someone that's been vaccinated is, many magnitudes lower. But, you're still dealing with the same spike protein. And so someone that didn't get COVID, that got vaccinated, their body produces spike protein and had an adverse reaction to that, then possibly. But, there's no supposition that you're going to be producing spike protein ad infinitum. The research shows that usually within weeks to months after receiving a vaccine, the mRNA is broken down, you're not producing more spike protein. So I don't think that you need to worry as much. I would be more worried about natural infection and someone that presented with anosmia.
Wonderful. Thank you, Todd. Thank you for all the great questions and for everyone that showed up today.
Is there any way we can see this again? Can we review the thing from?
Yeah, I'm just going to talk about that for a sec. We're going to, it'll be available on our YouTube channel in the next 4 or 5 days. So Neelam just made a good point. We'll post it on our Facebook page when it's uploaded to the YouTube channel. There's also a host of other webinars that we've done over the last few years on our YouTube channel if you're interested. But this one will be on there soon. So thank you very much, Todd. It was awesome, great information. And we'll have you back again if you'd like to come back again.
Sure. Definitely. Some more Ayurvedic remedies or Ayurvedic perspective on this, because you had rushed off, on the last portion on Ayurveda. So maybe the herbal interactions and things like that those things will be interesting.
Sure, absolutely.
Yeah, that would be great. We'll organize something. Anyway, thank you everyone and good evening. And please join us as a member of the Ayurvedic Association of Canada.
Thanks everyone. Have a good night.
Good night.
Namaste. Namaste.